Did you know that up to 70% of travelers experience digestive issues abroad? Do you know how to protect yourself from it?
You're listening to Viasana, a travel medicine podcast brought to you by AMSA IMU University with Professor Gerard Flaherty.
Join us as we explore what travel medicine is all about, how you can protect your health while traveling, and the exciting career opportunities in safeguarding travelers.
Welcome back to the third episode of Viasana. I'm Tanisha.
And I'm Dennis.
And we are both medical students from IMU University.
So for today's podcast, we have with us two very distinguished guests. So firstly, joining us all the way from Ireland is Professor Gerard Flaherty, the ex-president of the International Society of Travel Medicine. Professor Gerard has nearly 20 years of clinical experience in travel medicine, and he holds a diploma in travel medicine from the RCPSG Glasgow, along with a master's in international and travel health and master's in medical education. So how is the weather like in Ireland, Professor Gerard?
It's funny you should ask, Dennis. We've had the most beautiful weather for the past month. We've had a really nice spring, but today the weather is actually breaking, so there's a bit of rain today. But we like to have periods of rain as well. We don't like when it's hot for too long. We're not built for that in Ireland, so we like a mixture.
Like a balance of both, right?
Correct.
Yes, we're so happy to have you with us.
Yeah, today, yeah.
It's a pleasure.
We also have Associate Prof Sunil here with us, and Associate Prof Sunil is a senior lecturer here in IMU University and under the pathology department in the School of Medicine. So, Dr. Sunil, how are you doing today?
I'm doing good. Thank you so much for asking.
Okay, great. So in the previous episode, we learned about some tips to prepare for the travel, what travelers should do before reaching the destination. So today we are diving a bit more deeper into what comes next. So how we should stay healthy when we're abroad, from lesser known risks for traveling to medications that you should be bringing when traveling. We'll be covering all this, covering what really matters when your feet hit foreign soil.
Okay, so before we begin today's podcast, Tanisha, I'd like to ask you a question. Do you ever bring medications when you're traveling?
I actually don't.
Actually, me either. So most of the times, I'm just too excited about the trip. I forgot about them. No, I just don't have the habit of including them in my packing list.
Yeah, I think same here. But not to worry, we have two experts here with us today to guide us on how we can stay safe and healthy when we're on the go.
So to kickstart the podcast, we would like to ask Prof Gerard, what are some of the most important medications that travelers like us should typically bring along?
Okay, good question. So I would divide it into two groups of medications. There's the prescribed medications that the traveler takes for their pre-existing conditions. And then there are medications that they may use for self-treatment at their destination. And we would normally refer to that as a travel health kit. And that would include a number of different things, mostly available over the counter in a pharmacy. And that is a separate thing. So to start with the medications that are already prescribed, the first thing is don't forget them. Make sure, though, that you don't, in an effort to save space in your hand luggage, take them out of the packets. So always keep them in their original containers, ideally with the product information leaflet still inserted, with the name of the person, the medication, the date, all of that clearly stated. This is important for customs purposes. Some countries are very strict about even medications for personal use. They must be identifiable as medications that are prescribed for you. So that's the first thing. And only carry them in your hand luggage. If you pack them in your checked luggage, then if that bag goes missing or gets lost or there's a delay, that can be very problematic. You need to have access to the medications during a long flight, for example, especially things like inhalers, insulin. Specifically insulin, for the traveler with diabetes, the insulin should always be in the hand luggage. It may become denatured and not work properly if it's kept in the hold. It'll be too cold there, so it'll freeze over. So that must be in their hand luggage. It's a good idea to have a prescription from your pharmacist or physician that you can use in the event that you lost your medications at the destination and you want to have them prescribed locally. Now, sometimes people think, well, if I lose my medication, could my doctor just phone a pharmacy abroad and have them dispensed? That's really not the case. They need to be licensed to prescribe in that country. And so the traveler will have to see another doctor to prescribe that medication. Having said that, in some destinations, it is easy to get certain medications over the counter, which would normally be prescribed in the person's home country. But a word of warning about having to depend on medications at your destination. For some destinations, counterfeit medications are actually quite common. It's a big industry. And these may lack the potency and the efficacy of the correctly formulated compound. So always try to have your own medications and don't depend on having to purchase them locally. You might be in a very remote setting where you can't reliably get them. So it's good to have a medical letter as well from your own doctor detailing your medical conditions. This is very useful, and you could even translate it into the language of your destination as well. That's another useful thing to do. For the travel health kit, there's a lot of guidance available on this. I would say there's different travel health kits for different kinds of traveler. What I would bring myself on a routine leisure trip for a week, for example, and what I would bring if I were going to high altitude on an expedition might be two different things. So I'd have a lot more in the latter case because I'd be very isolated and remote from medical support. But it's important to have things that would be useful for self-care, an anti-diarrheal agent, an anti-nausea medication, antiemetic, analgesics, but be careful with codeine. Transporting codeine across certain borders is restricted. So it's important people know that. Decongestants, but be careful with pseudoephedrine, because again, that's a raw material for the production of crystal methamphetamine. So again, very strict. In fact, many of the Asian countries are particularly strict about that. If the customs officer were to check the traveler's baggage. Antihistamines, various antiseptic creams, steroid creams in some cases, electrolyte powder sachets in case somebody got severe dehydration, vomiting, diarrhea. Obviously something to be able to treat a wound. I can go on and on. So the travel health kit actually should be quite comprehensive. And somebody shouldn't just depend on the local pharmacies because they won't always be close to an urban centre. You've got so many excellent pharmacies in Kuala Lumpur, for example. You're never far away from one. But if you're going to a very rural area, you do need to be self-sufficient. And of course, a lot of people end up buying these things at the airport. The airport pharmacy tends to stock the things that you would normally need. So yeah, very important topic, travel health kits.
If there's three medications that Prof Gerard that you could only bring, what would three medications?
Well, that's a tough one. I think an anti-diarrheal agent is very useful because travelers' diarrhea is so common and it can be so disruptive. And for mild cases, that's all the treatment that's typically needed is an anti-motility agent. Sometimes antibiotics are prescribed, but they should not be prescribed in every case. And only with very clear instructions about how to use them. We don't want to use antibiotics for travelers' diarrhea, self-treatment irresponsibly. And so the current recommendation is for their use in moderate to severe travelers' diarrhea only. And the opinions vary on this. It does divide travel medicine practitioners a bit, that very topic. Some really don't want us to use them at all. Others want us to use them more. But there's a happy medium, I think. But sometimes an antibiotic would be prescribed either orally or as a cream for certain types of travelers. These can be very useful. I mean, think of a little trivial wound you get that becomes infected. Have you got enough of a first aid kit there to manage that, to prevent infection? Hand sanitizer is something I'd always recommend,
Right.
not necessarily a drug, but that's something that would be very useful for reducing the risk of food and waterborne illness, but also respiratory virus infection as well. I think antihistamines are helpful. Some people have specific allergies, but you never know. There may be a food you're sensitive to, you get an allergic reaction to that. And of course, sometimes people are sensitive to insect venom as well and can get a very severe reaction. If you get a bite around the eyelids, you can have a swollen eye, it can be very, very uncomfortable. So good to have an antihistamine because you do need to take those soon after exposure. But it is hard to narrow it down to three, Dennis. I could give you three more just as easily.
Yeah, I think we can now move on.
Yeah. Speaking of which, in the case that maybe I'm going overseas and my drug and my essential medication got stolen or I lost it, what would you like suggest we do? Like, for example, I'm a diabetic patient, I lost my insulin and I'm overseas, I'm stranded. What would one do in that situation?
Yeah, this is a big problem, and we've mentioned diabetes now a few times. The traveler with diabetes should be encouraged to travel, but if they're using insulin, it's very, very important that they know certain rules around it. Um, it may be difficult to get the equivalent insulin. The concentrations differ across continents, and so it is really, really important you do your homework in advance. So the traveler should know where to look for insulin, and they'll need to go to a clinician who can prescribe that. It's a good idea that perhaps their diabetes specialist nurse or maybe their GP would be willing to speak to a clinician abroad if there's any doubt about that. So it's important that, first of all, they don't lose their insulin. It's really, really important that this is kept on their person all the time. Many people now are using insulin pumps, of course, but there's guidance around those as well. But that they would have enough medications to cover their whole trip and then some. Many people will say bring double the quantity and give some to your traveling companion so that if a bag is lost or missing, that at least you have enough to keep you going. But there's no substitute for having that medical letter from your doctor at home and a prescription. So at least a pharmacist at a destination can work out replacing that insulin or providing an equivalent insulin that's available, because the trade names will differ and that can be very confusing, and you want to be sure you've got the right concentration. And with medications, there may not be that exact medication available abroad if it's an antihypertensive, for example, but a local doctor may have to prescribe an equivalent one as close as possible to your one. So it does arise from time to time. It's important that people have travel insurance that they can afford to receive medical care, and it may or may not cover medications abroad, but at the very least, there should be no barrier to accessing medical care. And I think a lot of travelers overestimate the quality of the medical care they'll receive and how easy it might be to access it. It's actually quite difficult at times, and especially if there's a language barrier. If somebody is ill, they're not in a good position to be able to look for medical care. So I think people who have a pre-existing medical condition, it's always good if they have a traveling companion or buddy that can help out, and that they have good communication with their doctor and nurse back home.
I think that giving your medication to your travel companions is a good idea. I don't think I would have actually thought of that, because if like you're solo traveling, you're more at like risk of like in the case your medication gets lost, you're like more at risk of being in trouble. So actually that would actually be a good solution. I didn't really think of that actually.
Okay, so since we're on the topic of a special group of travelers, so I'd like to shift our discussion to them. So what kind of travelers would fall into this category, Prof Sunil?
Right. Okay. I mean, I would think of pregnant women, elderly people, children especially, not to forget people who are immunocompromised, and perhaps an adventure traveler is someone that we should include in this list as well. Yeah.
Would you recommend this group of travelers to visit their doctor or see the doctor before they go on extended, like long holidays?
Oh yeah. I mean, I was just thinking when you were discussing about diabetics carrying medication. So my mother-in-law is a diabetic. She travels from India to Malaysia, and from Malaysia to the US. So she has to carry her insulin pen, and she being quite elderly, she's capable of forgetting her insulin, which she did actually the last time she went back to the US. Now, very important to remember the legalities, right? So in the US, you cannot get prescription medication, especially if you're a tourist. So that means you will have to essentially try to get it from another country. In this case, you have to resort to getting it from India, right? So coming back to what Prof Gerard was saying, very important to plan your trip and carry your medication. Also very important to know the country that you're traveling to allows how many months of medication. Like, for example, in Malaysia, tourists are allowed only to carry 3 months, right? So if you do carry more, you may be denied to bringing that in. Okay, so to be very mindful of the country you're traveling to, be very mindful of the duration of your travel, where you're carrying this medication. I mean, I have in the past even kept my medication in my check-in baggage, which means that customs will actually screen your baggage and you need to explain, right? So if you not carry it in your hand luggage and you do put it in your check-in baggage, then I think you need to be ready to answer the customs officer with a prescription telling that these are for personal use. Yeah, so I think, yeah.
Yeah, I didn't know there are so much like laws and legalities. There's even a limit on how much medication you could bring abroad.
Yes. Yeah.
So actually important for these travelers to really discuss, especially for extended stays, like how they should go about managing their medications.
Yeah, that's right. I
Yeah.
didn't think of that also. Maybe I'm just wondering, like, from my point of view, what I would do if like I ran out of medication is I would try to like see if I can import it from like overseas. Is that like a solution that's possible, or would there like be other legalities to it also?
I think
in Malaysia.
Oh, sorry. Go ahead, Professor.
Yeah, I mean, in Malaysia that could have been possible. I have until last year actually been able to procure medicines from India. But late 2024, I think they changed the rules. So you now need an import permit to get medications into Malaysia. So which means you can't, right? So you need to be aware of any developments that's happened in terms of bringing medication in, right? And it can be very challenging. I actually came to find out that it takes 2 years to get an import permit, so which really doesn't make any sense. Yeah. So being aware of what the rules and regulations are in the country that you are visiting or staying and wanting to import medicines, I think is very important.
Thank you for sharing, Prof. Yeah, how about Prof. Gerard? What are some solutions or alternatives you would recommend for these group of patients?
Yeah, I think it's helpful to educate the traveler about how to obtain medical care. So it could be in the event of illness or in the event of medication running out or whatever. And so there are useful things you can direct them towards. So the International Society of Travel Medicine has a global travel clinic directory, and all members have access to that. And that's very, very helpful because you can check what destination they're going to and print off the clinic details of English-speaking physicians who are happy to see travelers at their destination. That can be very reassuring then to have that available to you. And it's also good to have to ensure that you have some idea of the healthcare facilities at the destination as well, especially if you're going to be a long-term traveler or expatriate. It's really, really important to know what's available locally. I mean, many sort of low middle income countries or higher middle income countries are becoming medical tourism destinations. So there can be excellent care available in private facilities. And so some people are traveling from very wealthy countries to less wealthy countries for the purpose of receiving medical care that's much cheaper than what they can receive at home. So some people are going there for medical care. But that's a different type of scenario. That's organized elective care. I suppose we're considering the traveler who just becomes ill during travel. In that case, it's so important that they know how to activate their travel health insurance and that it covers them for all eventualities and that they've declared any pre-existing medical conditions. So I would say just encourage the traveller to be a bit more aware of what to do, have a health management plan, what to do in the event of becoming unwell. We often refer to this in the case of people with asthma or COPD. You know, if they get a flare-up of their underlying condition, what are the steps that they take? It might start off with self-treatment and escalating their normal management. But then, you know, what's their threshold for going to a local doctor? So, yeah, I think it's just raising people's awareness. And even for people who don't have an underlying medical illness, they should know, especially if they're doing remote wilderness travel, they should know the limitations of the healthcare facilities there and have their eyes open around that because they can become ill too. And if they're a solo traveler, they're very, very vulnerable in that kind of situation.
Mhm. So, Prof Gerard, talking about solo travelers and becoming ill overseas, abroad, and they're alone. So, how should these travelers find a trustworthy or a physician that they can see?
Well, the ISTM directory that I mentioned is definitely a good source. The International Association for Medical Assistance to Travelers, IMAT, also has a free service. People can register on their website and then they can put in their destinations and they can get contact details for local physicians who, again, are English speaking and have experience with treating travelers and the kind of problems that they develop. Um, I think I can't underestimate the importance of travel insurance. You know, many younger travelers in particular forego the travel insurance option and travel health insurance, I mean now, because they think, well, you know, I'll never get sick. I've no underlying conditions. But in fact, they're very vulnerable to traumatic injury, which can be devastating. You know, it really can. I mean, they're often more adventurous. They will sometimes hire a car or get on a motorbike or quad bike or scrambler. They'll end up doing things that they would never do at home. It always amazes me when I ask travelers, well, do you normally, you know, cycle? Have you ever been on a motorcycle before? They've never been on one, yet they're planning to be a passenger on one in Vietnam, for example, where it's very popular. And their response is often, oh no, it's an organized tour, you know, this is a service provided. So they have absolute faith in the integrity of the motorcycle experience. Then I talk to them about the unpredictability of the roads there and other traffic, the density of traffic. Even if they're not the driver themselves, we know passengers are not great at wearing motorcycle helmets. You know, so much can go wrong. The pre-hospital emergency care facilities in developing countries are very rudimentary, if present at all. So you know, victims of road traffic accidents, unfortunately, you know, they may have survived in their own country with the, you know, ambulance services, but they may perish abroad because this isn't an ambulance service to get there. They mightn't even be able to activate the emergency services. So people should think these things through. Adventure travel, of course, is wonderful. It's very enticing, but I used to do a lot of high altitude trekking. I mean, I prepared very well for those trips, and the group prepared very well. And when I was the team physician as a volunteer, I always made sure I met the group in advance, and we considered all these scenarios. What if this happens? What if that happens? And also, I used to say to them, now you need to know what to do if I get sick as the physician, because then you're more vulnerable as well. And so they had to be familiar with the travel health kit, and they had to know who else to contact. You know, telemedicine can come in there. So this is a topic I think we could talk about all day. But I think the bottom line, Dennis, is planning. You know, be well planned, well prepared for this.
Really? Okay. Thank you, Prof Gerard, for sharing that. I myself am guilty. The Vietnam trip. Yeah, recently. Yeah. Okay.
Okay, since we are on the topic, I think the main takeaway is that you need to plan ahead and make sure you know where you're like the type of place you're going to and what you should look out for. But like while we're on the topic, maybe Associate Prof Sunil, do you think, for example, pregnant women, maybe they're in the late trimesters and they are going on a vacation, for example, are there like any activities that you think that they should avoid, or should they like reserve like their accommodation near the maternity clinics or anything like that would you is there anything that you would recommend?
I think the most important thing is to actually get a doctor's letter. I'm saying this because I've had this experience. Me and my wife were traveling to Singapore, and we were denied boarding simply because we didn't have the letter. So we had to make a last minute rush to the clinic in the airport. And this was like 6 a.m. So we had to wake up the doctor and then make him write the letter for us, come back. Some airports could have more than one terminal, right? So you actually literally need to take a train, right, in Changi. So that's what happened. But thankfully, we didn't miss our flight. So that's something you need to keep in mind. Not really necessary that you may have to stay closer to a clinic, but I think, yeah, I mean, you should plan out in such a way that if there are any emergencies, you have access to medical care. Pregnancy is something that not many insurance providers do cover, right? So you need to be absolutely careful, especially when you're pregnant. There's a lot of, I'd say, they are like literally flight risk. This is a group that you would categorize as a flight risk. So you need to be careful, especially when you're in the third trimester and traveling somewhere. Yeah.
Yeah, I think speaking from example, like from your experience, it's actually like a thing we need to consider before traveling. So I mean, I think it's like good advice to everyone out there, like who wants to travel, but like they're special groups of travelers. So
Yeah.
yeah.
So okay, so as we are nearing the end of the podcast, yeah, it has been an enriching and
Yeah.
friendly and insightful conversation with
Insightful.
Prof Gerard and Prof Sunil. Thank you for taking the time for this podcast. Before we end this podcast, we'd like to ask either Prof Gerard or Prof Sunil, do you have any final advice that you'd like to give travelers or to our special group of travelers? Yeah. So
if I could mention one thing that we haven't discussed so far, and that is to educate the traveler about what to do if they return with symptoms. I think that's important. And it's not just the traveler with some kind of medical condition, it's really every traveler. So I would always mention this. So when you return, you may be returning before that infection that you've acquired manifests itself. So the incubation period for some of these tropical infections can be several weeks. And so you could return home, develop symptoms, and then not link it with your travel. You might attend your doctor and not mention travel at all. And I know from a study we did years ago that a lot of people don't take travel histories or don't take them well. And so you may not even be asked about your recent travel. And so in that case, I think an illness that could potentially be very severe could be overlooked. And remember, in our case, you're returning to a country in Northern Europe that where the practitioner awareness of how to manage tropical diseases it varies a lot. Of course, infectious disease experts will be familiar with it, but a lot of doctors will not have any specialized training in tropical infectious disease management. So I think that's important just to remind the traveler, if you return, these are the usual symptoms, and they're usually, change in bowel habit, particularly diarrhea, maybe intermittent, arthralgia, fatigue. Arthralgia is sore joints, fatigue, a rash, perhaps a cough, weight loss. Just remind the traveler, these are the kind of symptoms people return with. If they've been to a malaria endemic area, even if they've taken malaria chemoprophylaxis, that's medication to prevent malaria, it's very important that they consider malaria if they have a fever. Malaria can present lots of other symptoms as well. It's important to always have it very high on your differential diagnosis in the ill-returned traveler. And I would say again, tell the traveler to mention malaria if they are sick and they're attending the emergency department. And once malaria is out ruled, then other conditions can be considered. So that's something extra, I would say. Educate the traveler that they might return ill, and it's important that they mention travel because somebody will know the significance. Somebody will know the geographic distribution of disease and will know that they're at risk of certain conditions. Somebody will be familiar with the clinical manifestations of tropical infectious disease. But their own doctor mightn't be that familiar with it, but they'll know that there's somebody that they can ask.
Thank you, Prof Gerard, for sharing. Yeah.
Associate Prof Sunil, do you also have any advice that you give any travelers who are going to travel?
Yeah, I would say the most important thing is actually to do a thorough research of where you're going. Simply because you may be traveling to an endemic area. I mean, especially now that COVID-19 is back, I think big time in Singapore and Thailand, you may want to, find out what's happening. You may want to take the necessary precautions, wear a mask, vaccinate yourself if you haven't, try to avoid crowded places. So know the place where you're traveling. Perhaps even know what the cost of healthcare could be. I mean, just from example, my son went to US. We traveled sometime in February to the US. It was very cold, snowing. So he ended up becoming sick. So we had to visit the pediatrician, and it isn't cheap, right? Consulting a pediatrician in a clinic costs you a lot of money. So be mindful that you might have to spend some extra money if you don't have any travel insurance. So these are all the things I think that you need to find out before you travel. Otherwise, you end up, being put in a situation which you never expected to be. Yeah. So to me, I think the research factor is the most important about the place that you're traveling to.
Okay, yeah.
Maybe we should appeal to the travelers listening out there also to be responsible travelers, so that they leave light footprints at their destination.
Yeah,
Absolutely.
Vietnam trip, but yeah. Thank you so much for all of your input. And actually, the next podcast episode, it will be on what travelers should look out for when they came back from their travel. So I think it will be
listeners can look forward.
You can look forward to more advice there what you can look out for when you come back. So thank you so much for all these new perspectives. We wouldn't have thought of this, and we wouldn't have thought of it that way. Yeah.
Yeah, so I think the greatest takeaway that I have is I always remember to bring my anti-diarrhea, my hand sanitizer, and my hand antihistamines.
Exactly. Yeah.
Yes.
Yeah.
Very good. You've been listening.
Yes.
Okay.
Thank you so much, Prof.
Okay,
So
thank you
this
so
is
much.
the end of the podcast for this episode. And yes.
Yes. Thank you so much.
Thank you.
Thank you very
Thank
much.
you, guys.
If you liked this episode, hit the like button and share it with your friends.
For more updates, find us on YouTube, Instagram, or Spotify.
If you have any questions, do put them in the comment box below or DM us on Instagram.
Until then, this is the Via Sana team signing off.